machines will vary in size, and they look very different. Some are smaller, some are larger, some are heavier, and some are lighter. You'll have an 8 wrap, a 10 wrap, and even beyond that. Your liners, your shader, and even a magnum. The basic workings of the tattoo machine are as follows. This one, for example. An electrical current runs through the 2 coils. The coils then become magnetized. And as the coils become magnetized, they pull on the armature bar. And when this action happens, it breaks the contact between the contact point and the contact screw. And when the contact is broke, it shuts the machine down. So as it shuts the machine down, the coils become demagnetized and releases the armature bar, which in turn goes back to where the contact screw and the contact point have made another complete electrical circuit. And this happens very, very quickly. So, thus, it gets your pull and your thrust on your needle. Now this happens so quickly, all you hear is a buzz. Again, an electrical current runs through the coils, pulls on the armature bar, breaks contact between the contact point and the contact screw, thus shutting the machine down, releasing the armature bar, making contact, completing an electrical circuit, and pulling on the armature bar again. You have your needle tube, your needle bar, your machine frame. This is your needle bar clasp that tightens down and holds the tube in place. This is a capacitor. Your armature bar grommet, contact screw, contact point. We have a lower spring, an upper spring, a locking screw that locks your contact screw in place as to keep it from vibrating and loosening and shutting your machine down. We have a binding post, and then we have your clip cord attachments being a post and then to the frame itself. course, this will vary between artists and their own preference on what speeds they prefer to achieve different effects. Also, machines may require different settings to run properly. Thus, this liner machine runs better on a setting of 12 compared to this one that runs better on a setting of 8. When purchasing a machine, always make sure that you purchase it from a reputable supplier. Most suppliers will send information on how they set the machines up to run, and most will ask information from you as far as what you want, your liner, your shader, so on and so forth. But most of them will come with the required or the recommended settings. Adjust accordingly or by any manufacturer's suggestions. Most of this comes with practice and getting to know your tattoo machines. There is some practical knowledge that should be learned about the tattoo machine before attempting to do repairs. I do recommend that before you tear into your machine and start messing with the contact points and the contact screw and the springs, is to make sure that you do know your machine properly. And I guess the best way is just to jump in there, but when you're first starting out, if you mess up your setting, your machine isn't going to run properly, and it's going to be very difficult for you to get it back to prime, per se. So before you tear into it and you start doing all the fine adjustments, make sure that you do know the basic workings of the machine and what one turn will do compared to 2 turns. The gap between the contact point and the contact screw for a lining machine, and when I say the gap between the contact point and the contact screw, this is the gap. Now, a normal setting or a normal gap on a liner machine should be approximately the width of a dime. One thin dime. This gap tells you your stroke on your needle bar. If you don't have a lot of gap, then your machine's going to run tight, and you're not going to get a lot of stroke. You're just going to be real short ones. So, and you don't, of course, want them to be real long, because then you slow down the RPMs of the machine itself. So there is that fine area that the machine's going to run properly and give you the best stroke possible. Again, this is one's own personal preference. So, again, the liner machine, the gap should be about the width of a dime. Again, that adjusts the stroke of your needle bar. For your shading machine, again, the gap adjusts the stroke of the needle bar. And if you have this contact screw screwed out too far, then you're not going to have a very good contact between the point net, and your machine may run badly or even miss. Just like an engine, misfire because the gap's too far apart. This you want to make sure your shaders are usually ran at a slower speed. You might notice here that the gap between the contact screw and the contact point on your upper spring is a little bit wider than what the liner machine was. On your shader, you want that to be, you want more of a deeper stroke, and you are running at a slower speed. So this should be about the width of a nickel. And these are just guidelines. Nobody says that they have to be the width of a nickel. Nobody says it has to be the width of a dime. But these are just common, basic, knowledgeable tattoo trivia. Again, the width of a nickel between the contact point and the contact screw. For more precise adjustments, and you need to remember that your contact screw adjusts the stroke on your needle bar. Your power supply should be used to adjust the speed. Let's take this machine for example. Now it needs tuned. So hooking up your clip cord, and of course when working with this and with the needle in the tube, be very careful. Machine, and I will be talking a little louder over the noise of the machine. You can tell by the sound that it's not properly running. Again, this is a liner machine. So the gap between the contact screw and the contact point is way too much. You can see there that's way over the size of a nickel. Now to adjust the machine, I'm going to turn on, first loosen the locking screw, and I want to try to get that smooth sounding stroke through this machine, just like a good running motor. And these adjustments are very, very small. Now that sounds pretty good, it sounds strong, and it sounds smooth. So be sure to tighten your locking screw to keep the contact screw from vibrating out. You should adjust the stroke of your machine with the contact screw. Adjust the speed of the machine to your power supply. You can turn it down, or you can turn it up. Always remember that you need a good stroke for proper penetration of the needle through the skin. If you have very little stroke, you're not going to get proper penetration. Again, adjust the stroke through your sets, through your contact screw. Adjust the speed of the machine through your power source. is one thing that I wanted to show you today, and that's a little trick. You can measure your stroke. I want you to notice the black on the grommet. Okay? As I press on the foot feet, you'll notice the gray. The gray tells you what your stroke is. As you adjust on your contact screw, you'll notice that the gray gets smaller. That tells you that your stroke is shorter. So adjust out where you have a nice stroke and a nice smooth sound. You don't want it idling too high, as reference to an engine, but a nice, steady, smooth stroke. When you achieve that, tighten your set screw to prevent the contact screw from vibrating out. In time, you will learn what works well for you and your own personal machines. Certainly, you want to keep your machines clean and sterile at all times. Other than that, there's not really a lot of maintenance involved other than cleaning and keeping them in a proper storage container when not in use. But a few things you might look for and watch for is certainly the performance of your machine. If you notice, no matter what I do with the contact screw, the machine just still doesn't run right. No matter what I do with the power source, the machine still doesn't run right. Well, a few things you might look for is carbon buildup on the contact point. This could be taken care of with a nail file, a nail board, and very lightly cleaning the surface of the contact point. Now these are silver and they are fairly soft, so if you rub too hard, you're going to wear it away fairly quickly. So very lightly with a fingernail board or a very fine piece of sandpaper. Another thing you look for is your lower and your upper springs may be wearing out. And then you want to change those out. But your springs last, a whole lot longer than, say, your contact point might last, or the tip of your contact screw. So it's not too often or very often that they do wear out, but they do occasionally, and they do need replaced. Make sure all your wires and your solder points are intact. Make sure that your contact screw is contacting the contact point and your spring. Rubber bands may be wore out and need replaced. Make sure that all screws and binding posts are properly tightened and in place. Another little thing that happens is people put the needle bar on backwards or upside down to where the needle is higher than what the bar is, and it should be flipped. The crease of your needle bar should always run to the right of you. The opening of the needle bar, right there, should always run to the right of you. Make sure that your needle bar is lined up properly with the needle tube. If this is off, then it can drag and scrape along the side of the tube. And in that case, your needle point is going to be off down at your needle tip. So if it's your liner, big trouble. Alignment, you want to make sure that your contact screw is aligned well with your contact point, as well as your armature bar should be aligned with the springs. If your springs are off and your armature bar is one way, then you're not going to have good contact and you're not going to have good stroke because everything else is off. So make sure that everything runs parallel and is centered throughout. Centered in the spring, centered on the coils, centered through the tube. Again, this will all become second nature once you get the practice and the knowledge under you. I'm not saying don't tear into an old machine and figure out how it works. What I am saying is, if it's the machine that you're using to work, don't tear into it unless you know what you're doing. For your safety and your client's safety, I recommend that you always wear surgical gloves to prevent any cross-contamination. It also shows your client that you care, and it looks much more sterile as well as professional. You want to always make sure that your tattoo field is clean and sterile. Your tattooing field being your countertops, your trays, your chair, anything that you may come in contact with during the tattooing procedure. I recommend that you use an antibacterial spray. Before you start any tattooing, clean your countertops, clean your bottles, wipe your chair down. Anything, again, that you may come in contact with, your trays, your cap holder, even your machines, you can wipe down with this antibacterial spray. Now, safety again, to prevent any cross-contaminations, your spray bottles should be bagged. your alcohol and your antibacterial soap mix should be bagged and disposed of immediately after each use. Your machines should be bagged, again to prevent any cross-contamination. The Hibiclens is for, I use it to sterilize and clean the skin area that I'm about to tattoo. I also use it to transfer my carbon outlines. After every use, I suggest that you dispose of the needles used on that individual. The cost of a needle today is very reasonably priced. They're certainly worth the $1 or $2 that you pay for them a piece, and they're probably a little more than that, just to keep from the frustration and the time consumption that making your own needles will cause you, especially when you're first starting out. So again, wipe down your tattoo field. Your tattoo field being your tabletops, your countertops, your chair, your trays, your machines, your bottles, your just anything that you're going to come in contact with. Your light, you may want to spray down after using. Just anything you can think of, actually. It's better to be safe than sorry. Now, I do recommend that when sterilizing, that you date and label each package of what size needle and tube you have in it and the date that you sterilized. As far as myself, I re-sterilize after anywhere from 5 to 10 days of shelf life. I'm sure that once you get busy, you'll use them up in no time. But after 10 days, if something sits on that shelf for longer than 10 days, I tear it out and wipe it down with alcohol and re-sterilize. Now, you will want to check with your Board of Health for any stipulations or regulations that they may have on their sterilization procedures or what they require. Always use a quality pouch and the proper pouch for the sterilization that you're using, whether it be a dry heat sterilization or a autoclave sterilization. These pouches have indicators on them that change from green to brown when properly sterilized. This is a good indication that the utensils or the parts that's in this package has been properly sterilized. This is an autoclave, and if you are not using one of these for your sterilization procedures, then I believe you are taking too much of a risk. Again, the proper pouches for the proper equipment. There are other pouches. Tubing is what it's called for the dry heat sterilization. Dry heat is extreme heat, as in an oven. And basically that's what it is. I do suggest that you buy and purchase pre-made needles. Again, these pre-made needles, $2 or $3 a piece, included in the cost of their tattoo. Is much more, it's worth that little bit of money for safety, and quality work, as well as the frustration and the time consumption that making your own is going to occupy, believe me. And if you're just starting out, you don't want to make your own needles. These pre-packaged or pre-made needles do not come sterilized. So you will remove the silicone tip coverings, protective coverings off of them, wipe them down with alcohol, put them in a proper sterilization pouch with the proper tube size, label and date it, and put it into the proper sterilization equipment. The proper time for an autoclave sterilization, and this will vary from state to state and from Board of Health to Board of Health. Be sure to check with these people to make sure if they have any stipulations or regulations for their part of the country. But usually 350 degrees at 25 to 30 minutes is more than enough to sterilize and sterilize safely. Again, an autoclave is sterilization under steam and pressure. This dial here is the temperature, and it also tells you the pounds of pressure that's in it. So again, it's sterilization under steam and pressure. Somewhat of a double whammy as far as killing any bacteria or infectious type microbes that might be in it. Again, if you're not using this type of equipment, you're taking too much of a chance. One other thing I might mention before moving on is whenever you remove a tube and needle from a package, or even before you package them to sterilize, be sure to check the needle points for any damage, whether it be dullness, barbed or bent needle points. If there is any sign of any damage, discard it immediately in a proper sharps container. Using damaged or old needles will hurt your reputation as well as your art. And most of all, it'll cause unnecessary pain and excessive bleeding for your clients. Once you get a bad reputation as far as doing sloppy work, or you may want to stretch that $3 needle just a little bit more, that $3 needle is going to end up hurting your art and your reputation. And once you get this reputation, you're fighting an uphill battle. So again, be sure to check all needles before use, after use, and discard them immediately if any sign of damage. Well, this will depend on the person receiving the tattoo and exactly where on the body the tattoo is being placed. Certain parts of your body will have thicker skin than another part of your body. For example, the skin on your arms are thicker than the skin on your chest. The skin on your legs is thicker than the skin on your lower back. Again, it depends on where you place it at the body. What you're looking at now is a schematic of the skin. The epidermis layer and the dermis layer. Now, to get a tattoo to be permanent, that's going to be anywhere from 1/16 to 1/8 of an inch. 1/8 of an inch being on the deep side. This should be sufficient to penetrate the epidermis layer. You do not have to really go deep to get a tattoo to be permanent or to stay and look well. If you can sufficiently penetrate the epidermis layer, that will hold a nice thin line, and as well as any tattoo can become permanent through that layer and that layer only. Now, I'm not saying that if you happen to penetrate into the dermis you're going to ruin everything. You're not. But as you can see, skin, under the skin, epidermis layer, dermis layer, and beyond that is fat tissue and muscle tissue. Okay, so now what you're looking at here, and I'm going to hazard a guess to say that this may be about anywhere between a 1/16 of an inch to an 1/8 of an inch in thickness. This schematic, and that's just a guess. But again, you do not have to really go deep to get the tattoo to be permanent. As a matter of fact, the deeper you go, you're more apt to have spreading of the dye, and over a period of time this will work toward the surface of the skin and blot out any definition or art value that the tattoo had at one time or another. Again, the best way I can tell you is to assume that this is the tattoo needle. And you're penetrating the epidermis layer. That's sufficient to hold that ink nice and tight. Now, as you go and you penetrate the dermis layer and maybe even a little further, I want you to notice the consistency of the tissue. Now, as you go through the skin layer and then below the skin layer, you get into the softer epidermis layer, and then you get into the dermis layer. Now, you see here as it changes the consistency between the tissue. If you go and penetrate into the dermis layer, this tissue is going to act like a sponge. And this is the best way I can explain it. So as you penetrate from here, you've got a nice line, and then you get into the dermis layer. Well, this acts like a sponge and is going to spread. That ink's going to spread on you, right? As soon as it hits that layer. Why? Is because of the consistency of the tissue. This tissue is going to act like a sponge, and the ink is just going to spread on you. Now, over the years, as your skin heals and is being replaced and flakes off and regenerates, well, this spreading tends to come toward the surface of the skin, toward the surface again, and pretty soon you're getting what your grandpa's tattoo looked like, which is something that you really can't distinguish what it is anymore, because of the spreading of the ink has worked its way toward the surface of the skin. So, but if you get and stay in the vicinity of the epidermis layer, you're going to keep that nice thin line. Yes, there will be some spreading, but minimal compared to the dermis layer. So you do not have to go and penetrate real deep. You get down into this, you're running into a lot more blood vessels, a lot more bleeding is going to happen, a lot more leakage will happen. Again, if you can penetrate the epidermis layer, and that will come on the stroke and the depth of your needle, you're going to find that you're going to have a much nicer tattoo, a much nicer tattoo line, or even color for that matter, and your definition and your art value will stay much, much longer. Again, just notice the condensity between the two tissue masses. Very weak condensity, a little stronger and solid. Again, your skin tissue is what holds all this other tissue inside. This is our armor, per se, what little bit there is. And this tissue holds this tissue in place. Again, here is another diagram or schematic of the human skin. As you can see, the hair follicle, okay? The depth of the epidermis is here. And then you get down into the dermis layer, which is here. And then this is the fat tissue, which again holds a lot more vessels and veins. And this is going to increase your bleeding toward the surface of the skin. So a tattoo doesn't have to bleed a lot to be good or permanent. As a matter of fact, very little bleeding in most cases is normal in today's art. This being because everything is done with such a finesse and a fine line and an artistic value instead of pack it in and get them out sort of thing. This diagram I wanted to show you again the depth that you really have to penetrate to get the tattoo permanent, and the depth that a lot of people, I shouldn't say a lot of people, but some people penetrate, which is much more than you actually have to. A tattoo today, if done properly, can last without the spreading of the dye. It will help. It will hold the fine line and definition indefinitely, provided that there is no damage through improper care, negligence in healing, or an abrasion of any other type. One more time. Penetrate the epidermis layer only. Very little bleeding, still holding a very permanent line. Penetrate the epidermis layer, the dermis layer, and into the fat tissue. You're going to increase your bleeding as well as more scar tissue. Because as you go into the dermis layer, you're damaging a lot more tissue. So, common sense says if you're damaging more tissue, then you're going to have more chance of infection as well as scarring. But if you penetrate the epidermis layer, then you're going to hold that nice fine line, less and less bleeding. It's going to heal a lot quicker because you're only penetrating this far instead of this far. It's just much better all the way around if you don't try to pile drive it or drill for oil, so to speak. So again, you don't have to go deep to make the tattoo permanent or to make the tattoo good. Before beginning any tattooing procedure, you need to make sure that your tattooing field is clean and sterile. I cannot emphasize enough stress on this part of the tattooing operation. You need to prevent any cross-contamination. If at any time that a client of yours gets infection from the neglect on your part of either not using clean or sterile needles or tubes, or just a dirty operation, then you're not going to do the business any good, and you're certainly not going to do your reputation any good. Again, before beginning any tattooing procedure, make sure that the tattoo field, being your countertops, your chair, your trays, your bottles, are all bagged. Your cap holder is bagged, and all precautions are taken to prevent any contamination. You need to start by making sure everything is clean, organized, and in its place. The first step is to prep the skin in the area where the tattoo is to be centered. I suggest you take your antibacterial soap mix and spray the area. With a single-use disposable razor, remove any hair follicles that may be in the area that is to be tattooed. And I suggest that you go at least a couple inches on either side of the design that is to be transferred, as to eliminate any obstruction that may occur during the tattooing procedure. Removing the hair from the area is to prevent any unwanted hair follicles holding inks or dye to obstruct your view, or the hair itself can get infected from the abuse of the tattooing procedure. So again, remove any unwanted hair. As soon as you have done this, dispose of the single-use razor immediately. And after doing this, take your alcohol bottle, spray the area, again with a sterile cotton swab. Clean the area thoroughly. Fan the area dry. Now your skin area that is to be tattooed is clean, sterile, and free of any obstructive hair and any bacteria that might have been there. After sterilizing the skin in the area that the tattoo is to be performed, you need to either draw in a design or apply a stencil. And there are many different kinds of stencils. Today we'll be using the most commonly used today, which is a infrared transparency carbon stencil. And what this machine does is, through heat and light, is transfer your desired design onto a piece of paper in carbon form. Now, to apply this type of stencil, I recommend that you use a Hibiclin solution, which is more commonly used for ear piercings and any other small skin abrasions. With a sterile cotton ball, apply a liberal amount of solution covering an area that is larger than the design being transferred. Your Board of Health would rather you use this type of sterile solution than a speed stick or deodorant stick, as this can cause the transfer of unwanted bacteria from person to person. Now, with very light pressure, center your design in the desired area that you want the transfer to be. With light pressure, hold it for several seconds, 20 to 30, and you always want to make sure that the design is centered in the area to be applied. You don't want it off to the left, you don't want it off to the right. You want to make sure that it is centered. Very gently take the paper and peel it away, revealing your desired outline. Allow this to dry before proceeding with the tattoo procedure. When tattooing any design, you need to keep the skin tight and taut as to allow proper penetration of the needle. If the skin is not tight, then the needle is going to tend to bounce off the surface rather than penetrate. So you need to make sure that your skin is tight throughout the procedure. And there are different ways of stretching the skin. And I'm going to show you the most commonly. Certainly, when doing larger areas as chest, back, stomach, and so on, it's always wise to have an individual around to help in this process. A husband, a wife, apprentice, or just their husband or wife. Get them involved. You need to keep the skin tight at all times. Now, the most commonly used stretching technique is bringing your hand to the back side of the area that is to be tattooed with your thumb and your forefingers, grab and pull together, keeping that skin tight. Another one is that you're going to find that you're going to be doing a lot with is between your thumb and your forefinger. Taking your finger on one side, your thumb on the other, and stretching. And then working in between the two, wherever that may be. Another one is your thumb and pulling down, pulling left, pulling right, pushing up, again pulling down. You have to keep the skin tight, and so whatever way it may call for, you need to keep the skin tight to allow proper penetration. Outlining the tattoo is probably the most important part of the tattooing procedure. Good lining leads to good tattooing. In the business of tattooing, there is no room for mistakes. Therefore, it is wise to get it right the first time. As in life, you will have your good days and your bad days. A word of advice: if for some reason you don't feel like tattooing, don't. Take the day off. All your concentration needs to be on tattooing. Try to leave your other problems aside. Also, when outlining the tattoo, you need to be very careful as not to let your machine run out of dye, as this will cause you to do a dark line into a very light line. This increases your chances of double lining because you have to go back and darken in the line to get it even. Be very careful when dipping your machine into the cap of dye, as if you hit the sides of the cap or the bottom of the cap, this is going to damage the needle tip and damage your tattooing right from the start. So be very careful and inspect your needles and needle tips periodically for any damage. For instructional purposes, I will be using a stencil on paper. I will be using colored pencils and pens to demonstrate on how to properly outline and shade a tattoo design. It all basically works the same, only on human skin you cannot wrinkle it up and throw it into the waste paper basket. So again, you need to make sure that it's properly done the first time around. Now let's proceed. Outlining the tattoo, you always want to start at the bottom of the tattoo and work your way sideways or forward. Do not start at the top and work your way down. If you do this as you're working, you're going to smudge and distort your design as you move. Now, before doing any tattooing procedure, after applying the stencil, allowing time for it to dry, apply a very thin coat of Vaseline. Now this is for the purpose of keeping the skin soft and supple, allowing the needle to penetrate a little easier, and it also allows you to maybe slide a little easier. Now what you do not want to do is, when I say apply a thin coat of Vaseline over the stencil, is on the stencil itself. Not off to the side too far, off to the left or to the right too far, as this will compromise your grip and stretching of the skin for allowing your fingers to slip and slide. So just the tattoo design only, and being very careful not to put too much Vaseline on there.
Okay, proceeding with the outline. Now again, starting at the bottom of the design, and not necessarily the bottom, but the bottom of the design. Working to the left or to the right, and this will vary left hand or right hand. Your start point, your stop point. And for instructional purposes, please imagine that the tip of this pin is your tattooing machine. You would find your start point and your stop point, wherever that may be. Here, myself, I would start here, and I might mention before I start marking, you need to move at a steady pace. Not too fast, not too slow, just a nice, smooth, steady stroke. So again, imagine that the pin is the machine, and it works basically the same. Start point, stop point. Start. Stop. Start. Stop. And again, you don't want to stop in between your start points and your stop points, as it's going to make it very difficult to match the lines again. Say that I started at the tip of this thorn and was going down to the bottom of the stem, and I stopped halfway. Well, at this point, if I went from here to here and stopped, now I've got to match exactly where I stopped here. And that's going to be very difficult, and most likely, as you come around and you stop, you're going to go off this way, and it's going to be very difficult to match lines again. Again, start point, stop point. Start, stop. And again, it's very important not to stop and allow your machine to run, as this is going to cause puddling. If you start and stop and keep your machine running at that point, well, what do you get? You get these puddles. And if you start and you let your machine run before, again, you're going to get these puddles. So when you start, let your machine, before touching the skin, let your machine run. And as soon as you touch that skin, you be ready to go from your start point to your stop point. Again, start, stop, start, stop. Being very careful not to stop and allow your machine to puddle. Outlining, again, is the most important part, because if you do bad lines, then you're going to have to go back and touch all that stuff up, which is going to lead to double lining, heavier lines through part of the design, and lighter lines through the rest of the design. So again, all this is going to come with practice and knowing your equipment and the proper speeds to operate at. Basically, that's the outlining, knowing your start point, your stop point. Do not allow your machine to puddle, meaning, again, as soon as you touch that skin with that machine, move. A nice, smooth, steady stroke. Not too fast, not too slow. Start point. Stop point. Most likely you're going to use a larger needle, being a 14 round or even a 6 or 7 round. You want to be very careful not to overwork the skin. And a proper way to pack in color is using very, very small circles. And again, this is the point of your machine. Using very small circles. Left or right circles, it really doesn't matter. And you could actually go back in different directions if you choose. Very, very small circles. Now, as you look at this design, you think, wow, that's an awful large area to color. And yes, it is. And most likely, if we was tattooing this on an individual, it would be smaller than this. But for taping purposes, I've enlarged it, and for instructional purposes, the design is larger than normal. But the aspect of filling in and coloring in and packing in is basically worked the same. Very, very small circles. And I'll try to get you to... And when coloring large areas, take and cut it off in small increments, little small squares. And finish an area and move on. Cut you out another square. Very small circles. Now, as you watch this, and we're moving in very small circles, I'm holding the pencil just as I would my machine. A little awkward for taping purposes, but it's still held the same way. Again, very, very small circles. Finish this up. And move on. Now, I'll show you what happens when you try to do too large of an area, or if you get in a hurry, trying to hurry through the tattoo, trying to hurry and get it done, whether you be bored with it or the person seems to be in a hurry, whatever. You know, don't ever get in a hurry when doing a tattoo. Take your time, and remember that this is your reputation at stake. So now you're using a 14 needle round, and you're trying to hurry, and you're using maybe a little bit bigger strokes or circles than you would. Well, what are you going to get? Just like I showed you here, light coloring. You're going to have open skin areas all through the colored pattern. You do not, and this is going to lead to you going back and doing it some more. Still with the big circles, not using the small tight circles. Yeah, you're getting it in, and yeah, it's getting better, but guess what? By this time, you've just damaged all that skin in that area. And 9 out of 10 times, that's going to turn into scar tissue, because you've just damaged the tissue that holds a nice, tight solid color pattern. You've turned it into hamburger by going over it. This one, from using the larger circles, you've just turned this into hamburger, and it won't heal properly. Again, it's going to be scar tissue, and you're going to try to come back later. Well, why is this like this? And you're going to try to color it in again, and scar tissue is never going to hold the ink or dye as a good, solid, healthy tissue will. It's going to bleed more. It's going to be a heck of a lot more sensitive, and the client's going to be reluctant to have you do any more work because of this. Now, again, using very tight circles. It may take a little longer, but you're going to notice that the colors are going in, the skin is receiving it much, much better. And I might mention through this, you're working these very tight circles. You're working these very tight circles. And you're wiping. You're doing a little bit, and then you're going to wipe. Okay? Now, as you wipe and you wipe and you wipe, this is going to get sore, so periodically, another very thin coat of Vaseline over the area that you're tattooing. It doesn't have to be on the whole pattern. So it may take a little longer to get that packed in there, but it's going to be a heck of a lot better than you may go over it once with the small circles. You may have to go over it 3 or 4 times with the large circles, and this in turn is going to increase damage and scar tissue. So very tight, small circles. Squaring off areas. Don't try to take and color in, maybe half at one time, because that's just going to lead to that light, spotty, insufficient coloring, and more damage and more dissatisfied clients than moving a little slower and doing a proper fill as you should. And of course, always making sure that your equipment is quality, top-notch, and that your needles and your machines are tip-top shape. That's the key factor. If your equipment, your needles aren't quality or are up to par, then your tattooing and your coloring and your lining, nothing else is going to be up to par. So the main thing, make sure you have the quality equipment, knowing how to use it, and how to do it properly. Again, working this pencil as if it was my shader or my liner. And in this instance, it's my shader. So, I want to give this petal shape and definition. I want to make that petal look as real as possible. Okay, first off, I wouldn't try to color it solid. As I look at a flower, I know there's shine parts on it. I know there's lighter parts compared to darker parts. I know that there's shadows and depth throughout the flower itself. So, acting as if this is my tattoo machine. Again, my bridges. I'm holding it just as I would, and probably in the length that the tip might be. So at this point, I'm going to go in a directional flow. And I'll try to allow you to see it through the taping. Again, notice the flipping action. Before I touch that skin, I know where that needle is going to drop. Okay? And I do not allow the needle to set on the skin and then start. Your needle is away from the skin, your machine is running, and then you just kind of flip it right up there. Being careful, of course, just like in any coloring aspect, not going outside the line. Now, you would not do this much work without wiping. I would do a little bit, wipe. Do a little bit, wipe. Now, I'm not trying to make this solid as I was the heart, okay? I want this to gradient color. I want this to be light so I can go back and darken the edges to the proper tones. Once I go too dark, I can't go back. So it's best when doing this type of shading and coloring to do it in a light form, and then you can always go back and darken the areas that you prefer to be darker. Now again, in the directional flow, okay? The directional. We know that this flower, this petal is running this way, that it's dropping down. And we know that this end is flowing up. So in whatever direction that these petals are going, try to work in that direction. That's what's going to give you shape, definition, and the artistic depth, if that's the word I'm looking for. Okay, now as you've worked up, now you want to go into here and work down. Again, this is your machine running. You're wiping, you're working, you're wiping. Wiping. Okay. Now we've almost give this petal, it's a start. We've almost give this petal shape. And a directional flow, for that matter. Again, going back and darkening up the areas, the edges, and whatever. We know that this might be a little darker in through here because it folds into the center of the flower. But again, if you go too dark, then it's too late and you can't go back and lighten that up. And we know that underneath this petal, that there should be a shadow as this petal flows over the top of this petal. So you just come back, just darken a little shadow underneath there. Again, working this pen or this pencil as if it's my machine. And you do not have to, as you do with a pencil, you might press a little harder. With your machine, you do not press harder, okay? All you're going to do is just damage that way. You're just going to damage the skin, cause the needle to drag, cause the needle to hook up, stop, and possibly rip the skin. So with your point and with your needle, to darken, you're continuously going over the same area. Again, being very aware not to overwork the skin. Speeding up the process, again you'll see that I went ahead and shaded the petals of the flower. Again, as you see this action with the pencil, you can achieve the same sort of effect with your shading machine. Again, starting out lightly, working in the directional flow from edge, flipping and lightly lifting as you work it. Going back, darkening in the areas that need to be darker for shadows and depth of the tattoo. A few other things we need to be touching on is properly coloring the tattoo when it's time to. Now you should always do your black and gray work first. Now make sure your outline's completely done as you work, and if you have to go back and do more black work, well then you're going to wipe that black dye off, and then it's going to run over the surface of your color, which is going to color, distort the color, as well as dye the skin that's already perforated and open. So it's going to change the color, especially yellows, oranges, and even reds and blues. So you need to be very careful and very aware that your black work is done first. Now, you can come back and do a little black and gray work to enhance the depth of the petals. By this, I would suggest by either letting it heal first and coming back and doing some more gray work, or diluting your red with a little black. Now you're going to see a big difference as far as depth once we get this other color mixed in with it. Again, this is your machine tip and needle tip is the point of this pencil. So being very careful and still working in the directional flow. Think where them shadows would be. Think where the 3D effect should come into play. And you don't have to cover the whole design again. Just where it may be a little darker and depth. Again, this is your needle. Being very careful to watch and pay attention to the skin as not to damage it. But I would prefer, when I do stuff like this, that I've diluted my red to almost black, so it's not going to be that difficult to accept or even go over the area again. A lot of your clients will be one-time drive-through clients, so it's going to be difficult that if you want them to leave with the proper, is to make sure that this gray work was done prior to your color, your shading, your shadowing. That is basically your shading and shadowing technique. Again, moving very slow, not overworking the skin, not trying to pack it in large circles, but very, very small, tight circles. Your shading is done with the flipping motion, Start, flip, start, flip, start, flip. You do not want to stand here and work and work and work in a tight circle, or you're defeating your purpose of any definition and art through that design. So be very careful not to go too dark at the start to where you can't go back and lighten the area up. Now let's review. One thing that I didn't touch on that I should have is your start point, your stop point. You want to be very careful as not to what I call crossover. Your crossover would be start, stop. Your start point, your stop point's down here, and you start and you stop. That's the way it should be. But there's this chance of going a little further or this way. That's what I call crossover. And this can be very minute at times. So as you start a line, make sure you stop and get your machine out of there before you go to that point of crossover. Again, start point, stop point. Get your machine out. Start, stop. Again, double lining is going to lead to when you have to go back and darken in a line because it's too light. Well, as for example, if this line is too light and you have to go back to where this side is thicker, that's thicker, then you're going to go back and you're going to try to darken this one in. Well, and it's not hard to do this number. But now you've got double lines. So then you got to go back and fill that in, and pretty soon you've got something that is nothing like it should be. So, start point, stop point. Do not allow your machine to run on the skin. Have your machine running before you touch the skin. As soon as you touch the skin with the machine, move in a slow, steady stroke. Not too fast, not too slow. Again, if you're moving too slow and if you stop, you're going to get your puddling effect. And if you stop between the lines instead of your start point and your stop point, then you're going to wind up with this being a line that you cannot, most generally, match up again. After finishing the final steps of the tattoo, clean the tattoo thoroughly with your antibacterial soap mix. After that, I recommend that you spray the tattoo with a little alcohol. Now this will sting, and but it's very important to kill any bacteria or germs that may have been left behind. Pat the area dry with a paper towel and apply a very thin coat of ointment. Now, a proper tattoo will not bleed excessively. A proper tattoo does not have to have big, thick scabs on it. A proper tattoo, a good tattoo, bleeds minimally, and if properly taken care of, bandaging can come off in a few hours or less. Apply a very thin coat of ointment. You do not need a large amount. Adhere a good quality non-stick gauze bandage. Now most likely as soon as they walk out the door they're ripping it off and throwing it away. Hopefully they don't. And when they do, they dispose of it properly. But for your sake, for your own conscience, bandage them up with a good quality bandage when they walk out the door. This will keep it from sticking to the tattoo. It will look professional as they walk out the door, and they'll know that you cared enough to put a quality bandage on them instead of just some piece of paper towel. Before leaving, you should thoroughly go over the care instructions with them. Make sure that they understand exactly what they're supposed to do. Recommend that they stop back in a week or two and let you do a follow-up on this tattoo work that you've performed. If any touch-ups are needed, I suggest that you do that free of charge. This again will work for your benefit as far as sticking behind and following up on your work. This in turn will bring you more clients. You can only inform your clients on how to take care of it. You cannot follow them around and make sure that they do it. The biggest problem that I find most people have is when they apply the ointments, whether it be a triple antibiotic ointment or the A&D ointment, is that they just gob it on there. Emphasize that they do not have to gob this ointment on. And I recommend, and this is my personal choice, A&D ointment. If they would go out there and you knew for sure that they was going to apply the ointment properly and periodically instead of every 20 minutes, then yeah, it would be fine. But most likely you're putting it on 10 times a day and they're putting a lot of it on there. Triple antibiotic ointments are made to get in and draw infections out. They would put just a very thin coat on. These would be great. The A&D ointment tends to act and activate on the surface of the skin. It isn't as potent as what the triple antibiotics ointments are. So I prefer, if they're going to gob it on, that they use an A&D ointment more so than the triple antibiotic ointments. Now, of course, any sign of persistent redness, any sign of infection, they should immediately call a doctor, as well as you should inform them to immediately call a doctor. But most of the time, it's just a little redness. Either they've, through their own neglect, not taken care of the tattoo properly. But at least you know in your heart that you did everything possible to make sure that when they walked out that door, that they had a quality, safe, professional piece of tattoo work performed on them at that time. Again, stand behind your work. stay? First of all, you want to make sure that you have the best die that money can buy. There are all kinds of dies on the market today. Some great, some not so great. Check around and see what you prefer. Always buy from a reputable dealer. Some colors are harder to get to stay in than others. For example, yellow is a hard color since it fades faster than most colors. White is another color that is hard to get to stay, as well as getting it even. Always make sure that the skin is tight when tattooing colors. Check the dye, since it could be too thick or too thin. Most dyes, you're looking for the consistency of oil. Imagine the thickness of car oil and have your tattoo dye about the same. And this will vary from product to product. If the dye dries out fast, it's too thick. If the dye is clear and really runny, it's too thin. If you think the dye is too thin, then you might want to leave the cap off the ink bottle for a period of time so that the alcohol can evaporate. In time, the dye will become thicker. In the case that you think the dye is too thick, then you can add a little alcohol, or whatever the manufacturer may suggest that you use for thickening or thinning. One's idea of thickness will not be the same as others. With time, you will learn what's best for you. If the dye is not the problem, you might want to look at the tattoo machine settings. Adjust the stroke or the speed. Next, check to see if your needle is dull, bent, or barbed. If the needle is damaged in any way, then dispose of it properly. I recommend to use new needles on every client. There is always a chance that you may run across a bad or bent needle in prepackaged needles. I want you to imagine a fish hook, a very, very small fish hook. What's bad is the fish hook being pushed in, and even worse, being pulled out 1,000 times or more. That's what a barbed or bent needle can do. If at any time while you are tattooing and notice any damage to the skin area, or the dye just doesn't seem to want to go in, stop and let the tattoo heal. Always check the needles before using them. You might also want to check the skin type you are tattooing. Over time, you will find that some skin will accept the dye better than others. Now let's take a look at the causes and the remedies. The client may not take care of the tattoo properly. Before the client walks out the door, discuss the aftercare. Make sure he understands and that you even hand him written instructions before leaving the studio. They may pick at the tattoo. Again, be sure to instruct them not to pick at or force any scabbing or dead skin off of the tattoo. Dull or damaged needles may be the culprit. Inspect your needles before and during the tattooing procedure. Inferior dyes, again, make sure you have the best that money can buy, and this is one's own preference on what manufacturer or supplier may have. Improper stroke, make sure that you have the proper depth set on your needle tip. Improper speed, maybe you're going too fast or too slow. Make sure that the speed is set. And if you remember, the setting the contact screw adjusts your needle stroke. Adjusting your power supply adjusts the speed of the machine. You may be using wrong size needles for the area that is being tattooed. You may be overworking the skin. You need to make sure that you are very aware of what you're doing. Pay close attention. This person just doesn't accept well. And you'll run across this from time to time. Your springs are wore out, your upper or lower, or both. Be sure to replace and repair your machine as needed. Again, these are causes and remedies. Something you can look for. And I'm sure that if this doesn't cover it, then there's something else that needs to be taken a look at. Again, these are just basic problems that call for basic knowledge. Dye spitting. Dye spitting is when ink flies out the tip of the tube. If this happens, check the length of the needle that is sticking out of the end of the tip. Again, check the speed settings. If this isn't a problem, then there could be a hole in the tip somewhere. There could be what they call wobble, meaning there is space between the needle and the sidewalls. Again, let's look at the causes and the remedies. Needle point sticking out too far. That's out past the tube tip. Adjust your depth. Your speed is too high. Adjust your power supply. Needle tip of the tube is wore out. And this is from excessive use and rubbing and abrasion from the needle, rubbing on the tube tip. Most generally, you will find this in the bottom of the channel on a square tip tube. Inspect your tubes periodically. Rubber bands are wore out. If the rubber bands are wore out, then the vibration will travel through the needle bar, and usually you won't notice it until it's at the needle tip. Again, replace parts as needed. Proper maintenance on your machines and tubes should be periodically done. Excessive bleeding. There could be many reasons for this to happen. Dull, barbed, or bent needles. Excessive speed, or going too deep, or just a few. Another reason could be the client is thin blood, which results from drinking, drug use, or even some medications. Always check with the client to see if they're taking any medications before performing tattoo. If they are taking medications for any blood disorders, it could cause their skin to reject the ink. Any person taking medication for a blood disorder should not be tattooed. You should never tattoo a person who is intoxicated or under the influence of drugs, because this can cause thinning of the blood, which in turn will lead to excessive bleeding. You should have some ammonium just in case you come across a bleeder. Ammonium alum is an astringent to aid in controlling bleeding. Looking at the causes and the remedies. Of course, damaged needles. Inspect needles before and during the tattooing procedure. Excessive speed. Adjust your power supply. Penetration too deep. Adjust the depth of your needle, your stroke. Thin blood. Again, be sure to ask any medical questions if they're taking any type of medications, if they're taking blood medications, if they're taking blood thinners. People with heart problems take blood thinners. Obviously drinking, or if they're drunk. You should never tattoo a drunk.
It's just going to make for a bad experience for you. Certainly, it's not going to help your reputation or your art tattooing a drunk, because they never hold still. They're always moving. And besides that, you got to put up with the attitude. So, my suggestion, never tattoo a drunk or anybody who's under the influence of drugs. The tattoo won't heal. If a tattoo won't heal, there could be several factors involved. For instance, the client has an allergic reaction to the dye. This could be seen by noticing if the tattoo is discharging any fluid after 3 or 4 days of the tattoo being done. Also, if redness persists to remain around the edges of the tattoo, as well as soreness to the touch after 3 or 4 days. The client should be informed to see a doctor when he or she can be prescribed a stronger antibiotic ointment. If this occurs, that person should not get another tattoo. Another reason should be that the client has had staph infection at some time or another, which remains in their system. The worst possible reason may be a tattoo won't heal would be the tattooist did not properly and efficiently clean and sterilize the tubes, needles, thusly causing an infection. If it is found that the tattooist is the cause of the infection, it will be the start of his or her downfall. Causes and remedies. Allergic reaction. There is this, you can test the dyes first before you properly proceed with the tattooing, but this takes days. You should, or you could, take and do a dot in the area of each color and let it set for a couple days and see what happens. This is a way to check for allergic reactions. Staph infection in the system. If they've had staph infection in their life, most likely it will remain in their system, and when they get cut or hurt or scraped in any way, the staph infection tends to come out and they need stronger antibiotics, sometimes even medication. Not really enough time for it to heal properly. Be sure to give them the proper care instructions and give them an idea on how long the tattoo should take to heal. Use a stronger ointment. And dirty or unsterilized equipment. Please, no proper sterilization techniques. Broken lines. Broken lines can result due to several things. First of all, make sure the skin is kept tight. It could be dull or damaged needles. It could also be that you are not keeping an even depth, or you are lifting on the machine and not allowing the needle to penetrate evenly. Another thing might be you're moving too fast for proper penetration. Letting your needle run out of dye can also cause broken lines. Keep your reservoir tip of your tube not necessarily full, but a reserve of dye. Causes and remedies. Damaged needles. Again, inspect your needles before and during the tattooing procedure. Skin not tight. Lifting on the machine. Smooth, steady, even movement from start point to stop point. Needle depth.
Again, adjust your stroke for proper depth. You're moving too fast, moving too slow. Machine running out of die. Spotty lines. Usually, this results from moving too slow or even stopping between start and stop points. Again, the problem could be dull or damaged needles. Never pause and allow the needle to keep penetrating when going from stop point to stop point. Most often this happens when one is tattooing a line and goes on to another line while pausing slightly before doing so. Causes and remedies. Pausing while machine is still running. Do not pause between your start point and your stop point. And when you get to your stop point, lift your machine away from the skin immediately. Do not allow the machine to keep running on the skin surface, as you will puddle, die. Again, smooth, steady movements. Damaged needles. A barb needle is notorious for this. They will snag and grab the skin or snag up and stop in the skin. Check your needles before and during the tattooing procedure. Stopping between start points and stop points. Finish out your lines. Try not to stop in between your points. Double lines. This is usually caused by damaged, bent, or barbed needles, or a separation of needles from the needle group. Or when you go back to darken in a line, he or she can misjudge the previous line. Also, a buildup of tissue between the needle points could cause double lines to occur. Causes and remedies. Of course, damaged needles. Check your needles before and during the tattooing procedure. Needle separation. Needle separation can be caused from snagging, loading your needle into the tube. You get caught and maybe pull it away from the other needle grouping. Make sure your lines are done right the first time. Again, trying to reline and misjudging is probably the biggest culprit of this. So make sure that your lines are done right the first time. Buildup of tissue between the needle points can separate one needle or more than one needle from a grouping. Say you're using a 14 needle round and tissue paper from wiping over the tattoo builds up between the needle groups. This can cause double lining. Fat lines. This is usually the result of dull or damaged needles. Separation of the needles is also a possibility. Other reasons could include penetrating too deep and buildup of tissue between the needle points. Causes and remedies, again, damaged needles. Separation of the needles. But most likely, it's due to too deep a penetration. Check your needle depth. Buildup of tissue, trying to reline. Again, make sure you do the proper lining at the start. The angle of the machine. Your machine may be tilted left or right. And when I say this, imagine your 45-degree angle, or the angle that you hold your machine, and your tip is tilted to the right or to the left, and you're penetrating the skin at an angle. This can cause spreading and fat lines. Light lines. This could be the cause of several things. Of course, one being dull needles. The skin not being tight will result in light lines. The needle not penetrating properly, bouncing off the surface of the skin. Other possibilities could be not enough needle depth, the setting on the tattoo machine, or the setting of the tattoo power supply. Let's look at the causes and the remedies. Of course, obvious, dull or damaged needles. The skin not being tight during the tattooing procedure. Not enough needle depth. Adjust your stroke. Moving too quickly. Smooth, steady, even movements. Your speed too slow. Adjust your power supply. Shaky lines. This could be caused by the customer moving around while you are tattooing. Your hand could be shaking, or there could be too much movement in the needle tip, or the tube could be loose. One other thing might be that the rubber bands are wore out. Let's look at the causes and the remedies. Again, your client moving around. Inform your client before you can do a proper and a good tattoo. They need to work with you as much as you work with them. They need to sit still. They need to be calm and in control. They need to breathe properly and not get all worked up and worked into a frenzy. Your hand shaking. This will happen. You need to be in control. You need to show your client that you are in control, that you are the boss, so to speak. Movement of the needle point. Check your equipment. Your tube is loose. Check the clasp on the tattoo frame, on the tattoo machine frame. Again, replace and repair machine and parts as needed. Before starting the tattooing procedure, be sure to disinfect your work field, such as your chair, to prevent any cross-contamination from any previous work performed. I suggest that you use a disinfectant spray such as this. Spray down your instrument tray, as well as any area that you might be working in, countertops, etc. It's suggested that you use bags to cover your cap holder, as well as your spray bottles, your alcohol, and your antibacterial soap mix. These covers are to help prevent any cross-contamination. Always wear surgical gloves for your protection as well as theirs. Carefully remove tube and needle from the sterilization pouch. Holding the tube in one hand and the needle in the other, carefully slide your needle into the tube and through the tip of the tube. Do not bang or snag the needle. The needle points are very fine and can be damaged very easily. With your free hand, hold your machine and backslide your loop end of your needle and tube into your machine. Tighten your machine clasp. Place your loop over the machine armature bar grommet. Replace rubber bands to the top of the needle bar to prevent vibration and to prevent the needle slipping off the armature bar. Adjust your needle depth by slowly moving your tube in or out. The needle point should be flush with the tube tip. If the needle sticks out further than the tube, then this increases the chance of your needle snagging on the skin when in motion. To check the needle depth, push on the spring to see actual depth. Make sure the needle and tube is straight and parallel with the machine, not bent to one side or the other. Always be very careful and move very slowly to prevent being stuck by the needle. Always allow your client to view you opening their sterilized tubes and new needles. You should also have printed the date that the instruments were sterilized. You should use a quality pouch that has the indicators that change colors when sufficiently sterilized. Repeat procedure for other machines if needed. In this tattooing procedure, I will be using a 3 needle tight and a 14 needle round. Before starting, you should cover your machines to prevent any cross-contamination. Remove one corner of the cover and place it over the machine, being very careful not to snag the needle tip. Even this can damage the points. Attach the clip cord to the machine, then secure it with either tape or a bag tie. This will aid in the prevention of cross-contamination transferring onto your machine frame. Repeat for the other machines if needed. Before transferring the design or pattern, you will need to clean and disinfect the area that is to be tattooed. Spray the area with alcohol and use a single-use razor to remove any hair from the area. Be very careful as not to cut or scratch your client. Removing the hair is mainly to reduce the chance of infection as well as to reduce or hamper your view of the design. When finished, dispose of the razor properly. Clean the area again using the antibacterial soap mix. Pat or fan dry the area. Most health departments would rather you use the HebaCleanse solutions than the antiperspirant sticks, so as not to spread any bacteria from person to person. Apply the solution with a sterile cotton ball. Be sure to cover a larger area than the design requires. The HebaCleanse will also disinfect the area and allow you a sterile work field. When applying the transfer or design, always make sure that you center the design in the area that the tattooing is to be performed. Lightly lay the pattern on the area. Apply even pressure to the transfer. Be very careful not to move or slide the design around so as not to distort or smudge the transfer. Hold steady for several seconds to allow the entire design to be transferred. And with a slow peeling motion, remove the transfer. When starting the outline, you want to start at the bottom of the design and work your way up. If you start at the top of the design and work down, then you will damage or distort the transfer. As always, start at the bottom and work your way up. Find the start point and move with a downward stroke. Try to avoid working in an upward stroke, as this may increase the chances of snagging. Notice the position of my left hand under the arm, using my thumb and forefingers to stretch the skin. You want to keep the skin as tight as possible to allow proper penetration. Beginning at the bottom of the design, find your start point and your stop point. Start here, stop there. Move in a slow and steady stroke and go from one point to the next. Start, stop. I cannot stress enough importance on keeping the skin tight at all times. This will allow a smoother and cleaner looking line and reduce potential snagging. Notice the steady movement and the speed of the movement. Be very aware. Do not stop in between points, as this will allow the machine to puddle dye and result in a spot in the line. If you stop between points in the line, it will be very difficult to match up the lines again. You want to start at your start point and stop at your stop point. Start,
Notice the bottom 3 fingers on my tattooing hand. That's what I call my bridge. This allows me to support my hand and help steady the stroke. Notice the position of my left thumb below the design, pulling down to keep the skin tight. Start, stop. With this long line, be sure to find your start point and your stop point, which would be here, here, and here. If at any time I am not speaking or explaining the techniques being used, please pay close attention to the movements of my hand and the strokes being used, as well as the stretching position of my left hand. Remember, start point, stop point. We will at times be advancing ahead in the tape for timing purposes. There will be a time that the best teacher is to just watch. The smudge on the bottom of the design is out of your work area, so will not be a factor. If you would have started at the top of the design, this would have damaged the transfer and hindered your view of the lines. Here is a good time to mention the importance of keeping the skin tight. Hand under the area, thumb and forefingers pulling. Remember, start point, stop point. There will be times that you will use your thumb to pull down on the skin. Grasping and keeping the skin tight as to prevent the needle from bouncing. You will also be working between your thumb and forefinger, your thumb pulling down and your finger pushing up. If the skin is not tight, then the needle tends to bounce and results in poor penetration and leads to bad lining. For time purposes, we will be advancing ahead in the taping. After completing the outline, clean the area of all ink and dyes. Now it's not as important if you start at the top or the bottom, because you are not going to damage or distort the design. In this technique I will be using a 14 needle round. To achieve the wash effect, I used a soap mix bottle for dilution. Fill 3 to 4 caps with solution to wash out or dilute the black dye. Rinse, 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 becomes lighter, lighter, lighter. Dip your machine into the black dye and very carefully run your machine in the solution. When starting your shading or your wash effect, it is important to remember that you can always go darker, but you can't go lighter. So with light pressure, begin working the area to be shaded. You will need to pay close attention to the strokes being used. This stroke is called the flipping stroke. Note the flipping action. In this technique, the speed of your machine should be very low, and this will vary on your transformer. If you notice more lining than shading, then turn your transformer down. Adjust to suit. Again, watch the motion. In shading, it will be necessary to work in the upward stroke to achieve shape and definition. Very important to remember not to be too dark at once. Gradually work the shade needed. Work the machine as you would a paintbrush. You will notice at this point that the dye looks transparent. That's fine. While working the wash effect, it may not look like it's transferring to the skin, but it is. Be very careful not to overwork the skin area being tattooed. Be sure to keep your area clean and your view open. Again, notice the thumb and the forefinger. Stretching the skin, keeping it tight at all times. Now we want to achieve a translucent veil. Your dye at this point must be almost clear. This would be an area that if you are too dark, then you would lose total effect, and you cannot fix that. So work with a very diluted dye and very light pressure. Just skimming the surface of the skin. Darkening areas if it's called for. Again, if at any time I am not speaking or explaining the techniques being used, please pay close attention to the movement of my hand and the strokes being used. Keep your area clean and free of any obstructions such as smears and excessive dye. You will find that you will be doing a lot of work between your thumb and your forefinger, giving you that small area to concentrate on. Again, the flipping motion, light pressure, gradually darken as needed. Pressure, stroke, movement, and speed of the machine will all have a bearing on the type of effect you will achieve. To avoid repeating myself over and over, the best teacher at times is to just watch. Working with a very light pressure and light dilution, begin to shade the body form. Work in the directional flow of the body. Think about where the shadows might appear. A point that I might mention is that you will be adjusting on your transformer for the speed of your machine. Again, keep your skin area clean and free of any obstruction that might hamper your view. To achieve a full body wash effect, you will use a larger stroke with even slower speed and a quicker flipping action, and almost a clear dye. Just barely touching the surface of the skin, work in the direction of the flow of the shape that the body part should be. The part being the breast. The breast should be round, and at the bottom of the breast, work in an upward stroke with very light pressure. and continue until desired tone is accomplished. Again, the flipping motion, very light pressure. You can see the reddening more than the transfer of the dye. This is normal. Again, gradually advancing the tone of the gray from light to dark. If you know that the front side area flows in that direction and the back side area flows in the other direction, then work your machine in those directions. Again, with the shape and forming of the body part. Notice the large stroking movement and the transparency of the dye. You want to enhance and create shadow and shape. Again, if you know that the front side goes in this direction, then move in that direction. Flip in that direction. Again, very, very important to keep the skin tight at all times. Just barely skimming the surface of the skin. Shape and tone. Move in that direction, the backside in this direction. Notice the translucency of the dye at this point. Work in what I call half-moon strokes. Watch the movement of my hand and fingers. The flipping motion to be explained as follows. Heavy pressure, flipping to light pressure. Be very careful not to overwork the areas. You do not want to drag your needle across the skin. You want to skim the surface of the skin. What you do not want to do is during the wash effect is to pack the color in. There are areas that will call for heavy packing. Flipping very lightly. Heavy pressure, light pressure. Just barely touching the surface of the skin. You do not want to penetrate too deep. Just lightly skimming the surface. Now this is an area that would call for some heavy, solid packing. You need to be very careful not to damage the skin to the point of scarring. It's the skin that is tattooed, not the fat tissue or the muscle tissue. If the skin is damaged, then there is nothing to hold the dye in place with any definition. Again, the best teacher at this time is to just watch, and we will be advancing forward in the taping. With your art ability, knowing where muscle tone and shadowing and shaping might be placed is going to be half the battle. Coming back to finish the design, give the hip shape. Work in that directional flow, right to left. You can actually achieve a 3D effect. To finish, we will be covering the area to give the entire body color, wash color. Working in a directional flow, again, shaping the shoulder with very light pressure and light dilution. With the final shading, you want to be very aware as not to darken the area so much as to wipe out your detail shading. Again, with the large flipping strokes and very light dilution, shaping and shadowing the breast. This would be an area that could be easily overworked, so be very aware and cautious. Moving on to the blade. Notice the left hand pulling on the skin to keep it tight. I am still using the 14 needle round, but only the side of the needle is being used. Work between your thumb and your forefinger, again with very light pressure, shaping and defining the blade. Notice the bridge of my tattooing hand. 3 fingers resting my machine and giving me control. The little fingers resting on the skin and the other 2 raising the machine off the skin area. You notice the dilution is very, very light. Just lightly skimming the surface of the skin. That just about completes the wash effect and shading. There will always be those last minute touch-ups. We will come back and finish the detailing with the 3-needle liner through the eyes, the mouth, the beadwork, as well as the headband, the finishing lines in the halter and the cape. Again, at this time, the best teacher would be to just watch and notice the movements. Again, notice me pulling down on the skin with fingers. We will put the final touches on to the black and gray wash effect piece by connecting any lines and any last-minute details. Please watch to the finish of this design.